We're just going to go ahead and set up our Facebook Live. We'll get started in about a minute. Trickling in. Thanks everybody for joining us. We're just setting up our Facebook Live. We'll get started in a moment.
We're just going one more minute and we'll wait till Lilia tells us. My watch is slow. Oh, it's only 8 o'clock right now.
Okay, it's being finicky with me.
Those of you who are just joining us, thanks for being here tonight. We're just waiting a minute while Lilia is connecting in the other folks.
All right, we can go ahead and get started.
All right, well, good evening, everybody. Whoa, the end of a long day. I'm Julia Landau from Mass Advocates for Children. I'm thrilled to be here tonight with Dr. Joe Moldover, who's a developmental neuropsychologist who's just been doing a lot of really important cutting edge work in the field. He's always been a really important asset for the disability community. But now during COVID, he's been very involved in trying to address the complex issues around how to assess students during the pandemic in a way that's reliable and safe. So before we turn it over to him, I'm joined tonight, from MAC, like every other night. Helping us is Lilia Malekshi and Joanne Pino. Lilia will be reading the questions that you post, and Joe will be answering them as we go throughout the presentation. We are fast approaching the end of 2020, and we know that this has been continuing to be a long, arduous, complex process for families to navigate in terms of how to access evaluations and services for your kids. We will be going to monthly chats starting next January, the second Thursday of every month. There will be next month some updates about some new time and learning regs that will impact the amount of hours that kids are receiving, either in-person instruction or a live instruction remotely. So we'll be going over that and other updates next month. And Lily, you've got some other housekeeping things to go over.
Yep. So thank you everyone for joining us tonight. And once again, welcome back to all of our chat regulars. So tonight we'll pause throughout the presentation to take your questions. Please submit your questions at any time using the Q&A button on the bottom of your screen. If you're joining us on Facebook, please submit your question as a comment under the live stream. Christina Perez will be there to facilitate your Facebook questions. If you see someone else's question that you'd like us to answer, please give it a like. Also, please keep an eye on the chat box in Zoom and the comments on Facebook on our Facebook live stream for resources that we'll share throughout the presentation. Thank you.
And we do have just one polling question right now, just about what kind of disabilities your child have. If you can fill that out, that would be great. And I think we can just turn it over to Joe. Thanks so much for being here tonight.
Thanks a lot for having me, and thank you everybody in the audience for coming for attending this tonight. I'm always very happy to work with MAC and to do what I can to support these efforts. And the discussion tonight is on remote assessment in educational settings. It's going to be, we're going to talk a little bit more broadly, I hope, just generally about how to handle assessment during COVID. And remote assessment is one of the tools that we have for doing that, and we can talk a lot about that. But what I hope that we can kind of get into more deeply is simply how do we handle these issues How do we make sure evaluations take place? How do we make sure our kids get access to services and placements that they need in a way that is safe for everybody involved, both with remote assessment and using other methods? So please feel free to put questions in the chat. I hope we can get a discussion going. I'll just get us going with a little bit of background here. Flip this page. So I'm not going to belabor this because we've all just lived it all together. So I don't need to I don't need to tell you. But the point that I want to make about this timeline has to do with remote assessment. So January 19th, first COVID case reported in the US. March 15th was the initial shutdown of the schools for 3 weeks at the time. That was obviously then extended. And so at that point, essentially everything assessment related came to a screeching halt. School-based assessments were stopped. Most hospital-based work was shut down. My office and most other private practices closed their doors. And the question was really, how can we possibly continue to go forward? And we'll talk in a moment about some of the challenges to doing that. But there were basically sort of two important developments that then happened in May that I just want to make sure that everybody knows about. So less than 2 months after Governor Baker closed the schools, there was a very important release of guidelines by this organization called the Interorganizational Practice Committee, or the IOPC. And that simply was a group of a bunch of the neuropsychology organizations, the National Academy of Neuropsychology, the American Academy of Clinical Neuropsychology, just a number of the professional groups that are involved in this stuff, who kind of got together and pooled their resources to create this joint practice committee to figure out what are we going to do, and specifically, is it going to be possible to do remote assessment? So they issued this report on tele-neuropsychology, which is available for free online. You can Google it and look it up. The gist of it, of what they had to say, was that it is possible to do evaluation even if the evaluator and the student or the patient cannot physically be in the same space. And they went back over the history of it, which was interesting because there are some places where this has been going on for a very long time. Those of us who live in Eastern Massachusetts are kind of used to services being available in our town or in the next town over, or in the city or something like that. But there are many parts of the world where neuropsychology and assessment services are not immediately available. Australia, for example, which has most of the professionals concentrated in just a few cities. Texas has a similar type of a distribution. And so professionals in those areas have been researching this for a long time and investigating ways to do remote assessment. And there actually was a pretty good body of research on that. And so the IOPC reviewed all of this and issued these guidelines, basically saying, yes, scientifically speaking, clinically speaking, it is possible to do this. There are valid ways to do this. There is research that indicates that you can arrive at a good diagnosis, you can do a good assessment using remote assessment methods. This is possible, scientifically speaking. That still didn't tell us whether we would be able to do it. And around this time, a number of state departments of education were going in very different directions with this. So in some states like New Jersey and Pennsylvania, there was a really negative response to the idea of remote assessment. And the departments of education in those states came out saying that they did not want schools using reports that used remote assessment. I don't know if they've updated that in the month since. I don't sort of keep up with those states very closely, but I know that the initial response in those places was fairly negative. On the other hand, Maine went in a very different direction. Maine, the state of Maine, used some of the federal relief funds that they received to make sure that every school district in the state had a subscription for remote assessment through a private company. And so they went all in and said, yes, we're going to do remote assessment. And in fact, here are funds to make sure that you're able to do it. Other states just kind of left it up to the individual towns. New York kind of said everybody can figure it out for themselves. We were waiting in Massachusetts to see what would happen. And so about a week after the IOPC guidelines, Dr. Russell Johnston, who's the state director of special education at DESE, issued a technical assistance advisory, which is up on the screen. And it basically says, when in the best interest of the student, the department recommends that schools and districts conduct assessments remotely. It acknowledges that not all assessments may be conducted virtually. A remote evaluation may invalidate results. What they're basically saying is that this isn't going to be the right thing for everyone. This isn't going to be the right thing in every single situation, but that they do acknowledge it as a possibility, and that they wanted to leave the door open to doing remote assessments. And so at that point, as of May 21st, we knew that it was scientifically possible and that in Massachusetts, it was going to be allowed in the public schools. The COVID pandemic is obviously been hard for for everyone. For assessment, it's presented a number of challenges. And so once that door was open to remote assessment in May, people got very interested in it really quickly. And these researchers who had sort of been looking at things like remote assessment in Australia and places like that, and nobody was really paying a ton of attention to them around here, suddenly got really popular and had people very interested in their research. What are the challenges to doing assessment the old-fashioned way during COVID? Well, anybody who's been through it or had a child go through it knows it takes a long time. A full neuropsychological battery typically takes about 6 hours for a school-age child or older, give or take. It involves not only being in the office together, but also all of the incidental contacts. Under ordinary times, we had families all together in our waiting rooms, the bathrooms, the hallways, etc. It's typically done one-to-one, sitting at a table together. You're in a shared space for hours at a time. Many of the tests themselves involve use of manipulatives or physical pieces that both the child and the psychologist both handle. That was a big concern early in the pandemic when people were really concerned about surface exposure. I think people are maybe a little bit less concerned about that now. But in the WISC IQ test, famously there are the block design blocks that are used to construct the puzzles. There are nine plastic blocks that the kids have to turn and manipulate over multiple items, and so that was a concern. And then, I think if there are people out there who have done this kind of work in the schools or in hospitals, that the spaces allocated for testing are typically just terrible. No institution is going to allocate prime real estate for testing, including me in the office suite that I work in, the testing room that we use. These are typically spaces, especially in schools and hospitals, oftentimes are fairly small, don't have great ventilation, oftentimes don't have windows. And just so the physical space involved is oftentimes not optimal space for permitting distancing and ventilation. So, a lot of interest in figuring out how we could do this differently. Part of it was easy. When we think about evaluations, whether you're thinking about a neuropsychological evaluation or whether you're thinking about a team evaluation through a school, for these purposes, I encourage you to think about it in terms of performance-based versus non-performance-based assessment. And the non-performance-based assessment really should not be an issue. There's no reason why that has to slow down or stop in any way, whether everybody is at home or people are doing a hybrid or whatever. That should not be an issue. Parent and teacher interviews can certainly be done over telehealth platforms like Zoom. I was sort of concerned about doing that at the beginning, and I've actually found that it works very well. Student observations, similarly, I did an observation of a student this week where I was not able to go to where the student was physically, but a staff member set up an iPad with Zoom, and I was able to observe. The staff member moved the iPad when the student moved. I was able to ask the staff member questions over the iPad. It worked fine. And in fact, it probably made me less intrusive than if I had been there physically, as it was a little bit awkward to do an observation and to kind of sit in the corner and wish you were invisible. In this case, there was just an iPad leaning against a desk, and I was able to observe more covertly. So the observations can be done. The questionnaires, anybody who's been through evaluations, if there are teachers out there, everybody loves filling out the BASC questionnaires and the brief questionnaires and things like that. Those are all digitized. Those are all now available online, where you can just be emailed a link, fill it out online, click done. There's no need for things to be handed off physically. So all of the non-performance-based stuff works beautifully over the internet, provided that you have the right platforms like Zoom and so forth. The big concern, the big question is with performance-based testing. That is anything where we're asking a child to actually perform, to actually do something. This is going to include IQ tests. It's going to include any kind of educational tests like reading and math, speech language, OT, all of the neuropsychological tests. The big question mark is around those. And the question is, how much information can we pull out of the non-performance-based methods? So do we really need to do the performance-based tests for a given evaluation? And if we do, can we do it? Can we validly administer them remotely? And the answer to that second question is, to some degree, yes. We have online meeting platforms like Zoom. Crucially, the test companies have jumped on this very, very aggressively. So, for anybody not involved in sort of the world of assessment and testing, the thing to understand is that all of these tests are produced by different publishing companies. So the biggest is Pearson, the big educational company, but there are 4 or 5 different major publishing companies that sell tests. And every time I give an IQ test, every time I give a WISC, I am using a WISC that I have bought from Pearson. And so the test companies have tremendous incentive to keep things going, and moved very quickly to digitize the test materials and to create platforms for using them. So Pearson's platform is Q Global. Here's the take-home point. Here's the thing that you have to understand, that you don't have to sort of remember everything about every company, but the thing to understand is that the tests, the performance-based tests, to a large degree, have been made compatible with platforms like Zoom. What does that mean? That means that if I am doing a test online, I'm not just sitting here on Zoom saying, okay, let me ask you about this picture, let me hold it up to the camera, or something like that. The tests have been converted to a digital format where I can do a screen share, like I'm doing with a PowerPoint right now, with high resolution images that work very well. And so the digitization of the tests has allowed very, very quickly people to convert over to doing things like the WISC, like a lot of the educational testing, through a format exactly like this one, exactly like the way I'm talking to you now, where I could be on a Zoom with a child or an adult. You'd have a little window with me talking, you'd be able to hear me. Instead of my PowerPoint presentation, you might have materials from the test up on the screen that I would be asking you about or showing to you and so forth. So that digitization has been crucial in allowing this to move forward. And then just other tech updates like high definition document cameras that can be used to show pictures and to show documents to kids remotely and things like that. So the technology has come along really, really quickly. why don't I do one more slide and then pause for any questions that we might have before I plunge on, if that makes sense?
Yeah, sounds good.
Yep. All right. So, what I've been saying is that the technology is there. The IOPC says the research is there. DESE says that we're allowed to do it. All of those things have lined up. Nonetheless, it does not always work really well. And I want to talk a little bit about some of the challenges to remote performance-based assessment. Again, this is performance-based assessment. No one should tell you that there's no, I mean, at a minimum, somebody should be able to do a good clinical interview, good parent and teacher questionnaires, observe the student, etc. So that's just a given. So these are really challenges more around performance-based assessment. Number one, just the digital divide, variability in student access to and support with the technology. Not everybody obviously has a home computer, has a good quality internet connection, has space in their home or their apartment that can be used to quietly engage in online learning and testing. So variability in access is definitely an issue. That's the first two, the access and the availability of appropriate test-taking environments. You do need a quiet space. You need a quiet room. If you're not able to have a space where there aren't other people, where there's not a lot of noise coming from the other side of the door, where the dog isn't running around, where sort of all of that stuff is happening, then it's, I mean, when I do testing in my office, it's in a quiet room with, with nothing distracting, with sort of tan colored walls, with nothing to distract the kid. And it can be difficult to replicate that at home. Applicability of norms. So when these tests are developed, they're really designed to be done in person. And, there are some questions, if I say somebody scored at the 60th percentile on an IQ test, I'm comparing your performance to kids who took the test in person. And so, there's sort of concern over how much you can generalize from the one setting to another. And then finally, barriers to capturing subtle observational data during testing. A lot of us been spending lots of time on Zoom. We are all completely familiar with the idea that I can be sitting here talking to you and you don't know that I have my phone right here below the line of the camera and I'm checking Facebook. It can be, a real challenge with kids. When I'm working with a kid in my office, obviously the kid is right there. I can tell he's not on his cell phone. I can ask him to turn his phone off if it's pinging. Also, I can pick up on different cues. I can see him bouncing his foot really nervously when I ask him to read, in a way that I may not be able to pick up on when I'm doing it this way. So you only get this little rectangular window, and it limits the observational data you can get. So there are problems with it. There are limitations to it. And there are certainly situations in which it is not appropriate. So I want to emphasize that it is a possibility, that the technology and the science are there, but it is not a perfect solution for every single situation. Okay, I've been droning on for a long time. Let me just pause and see if there are any questions.
Thank you. So we have had a few questions come in. I'll get right to it. Our first question is, can you please explain the difference, if any, between assessments and evaluations?
Assessments and evaluations are essentially the same thing. I think that sometimes there's a difference. We talk about a difference between testing and assessment or evaluation. So testing is just the administration and the scoring interpretation of the tests. That is only one piece of a larger evaluation or assessment. And the evaluation or assessment is made up of three pieces: the testing, but also the history and the observations. And you've got to put those three things together to get a good assessment. And so, this is part of the point that I make when I talk about situations where we might not be able to get performance-based testing. Even if that's the case, we can still get observations not only my observations from directly, but also teacher observations over standardized questionnaires, parent observations over standardized questionnaires, and a good history from the parents, review of the IEP, review of the test documents, etc.
And thank you for that, Joe. And I think then there's a legal definition of evaluations, which really covers all those aspects of what you were talking about. So in order for kids to be determined eligible for special education or for the required 3-year reevaluation, what the law contemplates is not just the performance-based assessments. The law is very clear that it includes parent observations and observations of the parents' own observations and input, as well as, the observation of teachers and others, which is part of why I think the state guidance has made it clear that school districts should be looking at what they have available, even if they're not able to complete all the performance-based assessments remotely, and determine if there's enough information, since the federal definition of evaluation includes all that kind of information. Is there enough information to determine whether the child does need special ed services, so they don't have to keep waiting, and you can at least write a partial IEP? So it's a good question because it's got the legal and the other meaning as well.
Yeah, thank you for that. That's a great point.
Thank you. It's a nice segue into our next question. Is it beneficial to postpone a 3-year reevaluation?
I mean, Julia, this may all be another one where you want to sort of give a legal or sort of advocacy take on it. I mean, I think that from my point of view, I have concerns about doing that in most cases. I think that it is important to it may make sense to truncate it and to limit it, but I think in general, we want to be doing these evaluations in order to ensure that a child is making effective progress. And, it can be very difficult to determine if a child is progressing without the test data. One of the difficult things is that even if a child is progressing relative to their own baseline, so even if parents and teachers can just kind of look at the situation and say, yes, she is able to read things she was not able to read 6 months ago. She's able to do math problems she was not able to do a year ago. So that is progress. What you can't really eyeball the same way is where somebody is relative to their peers. And so, because everybody else is also moving forward. And so, somebody's reading might have moved forward relative to where it was last year, but if it's moving slowly, they may still have fallen further behind their peers than they were, which would raise a lot of concerns about progress. And you can't really tell that. You can't really tell where somebody is relative to peers without the test data. And so it might make sense in some cases to sort of winnow down the evaluation a little bit. If the child has never had sensory motor concerns, maybe OT testing doesn't have to be done at this point. But definitely in areas of concern, whether that's an academic area, whether that's around language skills, I think it is important to try to get at least some test data. I don't know, Julia, do you have a take on that from your point of view?
No, I think that's a really thorough answer. And I think, as the questioner seems to understand, that the school districts currently, they have to comply with the existing timeline. So if your child is due for a 3-year reevaluation, or somebody makes a referral for a reevaluation sooner than 3 years, then the school districts have to either move forward or to work with you to see if there's an agreement about what makes sense. Like Joe said, in a truncated way, do you agree with the school district that it may make sense to do part of the reevaluation now and perhaps wait till other parts can be done in person? So it's always going to be a judgment call, because you also know and can work with the evaluators about whether or not they, for all the reasons Joe was talking about, will they be able to participate in a performance-based assessment with enough accuracy that'll give you the information that you need. So I think there's going to be some, I assume I know you're going to be talking about this later, how do you evaluate whether or not it's going to make sense for your particular child to have performance-based assessments remotely. The other reason I think it's important to really think hard about whether to go forward is that whether to postpone is that we know a lot of students, because of the impact and the trauma and the stress of COVID, are experiencing potentially new needs related to their disability that are only going to be determined, and they might need additional types of IEP services. So if you're worried about some potential new areas of need that are going to require an evaluation, that are going to require services in the immediate future, then it becomes even trickier about postponing. So it really is going to depend on how your child is doing. I think, you know, it's an individual decision at the end of the day. Would you say that's true, Joe? Or
I mean, I think that's definitely true. And I think just sort of one thing that I'll add to it is that I do think it also depends somewhat on the age of the child and the areas of concern. And what I'm thinking of in particular is that, especially for some younger kids, there's a lot of developmental sensitivity to interventions. For example, language development, you know, tends to have critical periods for intervention where services are going to be more effective than they will later. And so I know the question was about, you know, reevaluation, but I think certainly sort of initial evaluations around diagnoses like autism and language disorder should not be put off. And I think that, you know, if you're dealing with a situation, for example, in which you have a child with language deficits, whether it's in the context of autism spectrum disorder or a learning disability, the child is younger, if the child is younger than about 10 years of age, then, you know, time is very precious, and it's a very sensitive period, and it's a very important time to be able to make sure that you're doing the right intensity of service. And so for that child, it's especially crucial not to sort of let too much time go by without checking in.
And the hope is that you can work together with the school district to really figure out the way to conduct as much as you agree makes sense to go forward with, and then to postpone to whenever they can do more things in person, which hopefully will, you know, I know a lot of school districts, even before they were providing in-person instruction, were providing some in-person evaluation. So hopefully, as our numbers become under more control, we'll see more of that in the future.
Thank you. We do have a couple more questions, but I can hold those for our next break. I know we've got some more slides to get through.
Yeah, just 2 more slides, so not too much, but
Okay.
we'll do a little bit more here. Okay, so how do we do this? What are the options, just kind of from a brass tacks point of view? Let me go over 4 different ways that this can be done. And then, you know, and as we've been saying, there's no one right answer. You've got to figure out what's the right answer for a particular kid. Option 1 is just doing it in person with precautions, doing it the way that essentially we used to do it, but with precautions, with masks on, with air filtration, with doorway screening, with staggered scheduling so that people are not encountering each other in the waiting rooms and the hallways, and so forth. Can also have office modifications designed to allow physical distancing on site. In my office, we have a room that is designated for testing, and in that room, we have a couple of monitors, and these are just baby monitors. These are baby monitors you can get from Amazon. They're remote monitors with a camera and an intercom, so that I can, in some cases, step away from a child, step into another room in the suite, still be able to see them over my screen, still be able to hear them, still be able to talk to them. I have 2 cameras set up. One is on the table that would be looking at their face, and one is on a shelf behind them looking down, so it can see what's on the table in front of them, like if they're working on math problems or if they're doing a computerized attention test. I can toggle back and forth and look at them and then look over their shoulder. I can hear them, I can talk to them and communicate, and so things like that. But you know, these are all sort of precautions to permit distancing for in-office work. So that's option number 1. Option number 2 would be never being in the office together. So this is the whole other end of the spectrum. never going to be in physically the same space together. Doing non-performance based only. So just going back to what we had talked about before, this would be a truncated evaluation. This would be saying, look, we're going to do an interview, we're going to do some questionnaires, we're going to get some teacher input, we might do an observation, but we're not actually going to do any performance-based testing. This may be appropriate in some cases, especially if it's a reevaluation and there does not, for whatever reason, seem to be a very pressing need to get more performance-based testing at that point, and that can be put off. It may also be appropriate in some cases for children who have a lot of difficulty with PPE, children who can't wear masks for sensory reasons and so forth. Sometimes we have to modify and go with something like this. This is not a full evaluation. It's very non-optimal. This is kind of the what we go to when all else fails. That's better than nothing. You can also, at the full remote end of the spectrum, do performance and non-performance based. I've done some of these with kids who really needed a full evaluation, and for medical reasons or for medical reasons in their family, were not going to be able to come into the office. That had vulnerabilities where doing an office-based assessment just wasn't advisable for them. And so we figured out how to do it. We figured out how to do all of the performance-based tests remotely. It's kind of a creative challenge, but it can be done. Probably the majority of kids that we see at this point are on a hybrid model, and that's the last slide here. And the theory with this model is sort of trying to balance all of the concerns. So trying to engage in risk mitigation by minimizing the amount of time people are in the same space together, but also making sure that we're getting valid test data, because some tests are better given online than others. Some of the performance-based tests lend themselves very well to online assessment. Others are clunkier or really don't work that well at all over a remote platform. So in a hybrid model, what we would do, if it's a battery that would typically be a 6-hour battery, I might decide I am going to do somewhere between half and 2/3 over remote assessment. I might decide I can do some of the intellectual testing, a lot of the academic testing, some of the memory testing, etc., over remote assessment. We've all been on these Zooms. We all know that once you get past about an hour, maybe an hour, 15 minutes, our eyes begin to glaze over. So the teleassessments, you don't try to do it for 3 hours at a time. We schedule little chunks, we schedule to be on with a kid for an hour, maybe an hour and a half with an older kid. And we do a few of those, and you kind of nibble away at the evaluation. You go on for an hour, you do most of an IQ test, you go on for another hour, you do the literacy testing, you go on for another hour the next week, you do the math testing. You chisel it down. And then when you bring the child into the office, you only have half, maybe a third of the battery left to do. And you do that efficiently in the office with precautions, ideally with some of the distancing strategies I talked about. So if I bring the child into the office, I want to do an attention test. It's a computerized attention test. It's not something I need to be physically giving. I will use the monitor to be able to do that, to be able to monitor that and communicate with the child from another room. So at the end of the day, it might be that I'm only physically in the exact same testing room with the child for an hour, or maybe an hour and a half out of the full 6-hour battery. But by using these strategies, I've gathered a full set of data, the same set of data that I would have had under ordinary circumstances. I'm confident in the validity of the data. I haven't exhausted the child. I've minimized the risk to myself and to my staff and to the child and to the family. And so that hybrid model, in many ways, in my mind, all other considerations aside, assuming that there are not particular medical concerns, particular concerns with a child wearing PPE, is oftentimes a sort of an ideal way to go. So there's 4 options. Finally, last slide, a document I want to make sure people are aware of especially if you're doing advocacy work, but this is also important for parents. As I mentioned back at the beginning, DESE has opened the door to doing remote assessment, has said it is doable in some circumstances. There is still some variability from town to town, from city to city, in terms of how special education systems are responding to this. Some systems are doing a great job. Some systems are doing remote assessment themselves. I'm doing training of school psychologists and special education staff to help them to do this. Several school districts have asked me to do that. DESE has asked me to do that. Other districts seem more seem less informed about it and more reluctant about it, and are not as receptive. So I want to make sure people are aware of this. This was a letter that was issued on June 8th by the two major psychology organizations in the state, the Massachusetts Psychological Association and the Massachusetts Neuropsychological Society. And they issued a joint statement specifically on special needs assessment in schools during COVID. The letter is available online. I can help anybody who wants a copy to get it. But what the document says is that it acknowledges that remote assessment is not appropriate for all students, as I've also acknowledged in this presentation. However, it also really emphasizes the drawbacks of not using remote assessment. And what that essentially boils down to is that early in the pandemic, early in April and May, people were really being forced into an untenable situation where they were being made to choose between doing assessment and potentially having a lot of hours of in-person exposure versus deferring assessment altogether and not getting information about eligibility and progress for sort of an indefinite term of time, oftentimes for kids who had very pressing needs. And what the statement says is that that's not an acceptable trade-off, and that even given the drawbacks of remote assessment and the limitations of remote assessment, it is clearly better than the alternatives of not doing assessment or of just plowing ahead and insisting on in-person assessment in all cases. So the statement therefore recommended that the assessments be used judiciously with caveats. But I think the letter is helpful from an advocacy point of view if anybody is encountering a situation where a team or a special ed administrator is objecting to the use of remote assessment. The letter recommends that evaluations not be disqualified on the basis of use of remote assessment. It recommends that districts that are contracting for independent evaluations not forbid the use of remote assessment. It really emphasizes the need to keep the door open on this. So anybody who is encountering obstacles in schools with this stuff will hopefully find that letter is a useful tool to be able to show administrators and special ed attorneys and so forth to demonstrate the validity of this stuff. So that is the last slide. Happy to take any. I know it's about 8:45. I'm happy to take any other questions.
Great, thank you.
So Joe has agreed to stay longer to keep answering questions. At some point, Joanne will just be doing in a few more minutes a poll to get your feedback. And just to remind folks, if you do have to leave soon, that our next chat will be, I don't know the date, the second Thursday in January.
January 14th.
January 14th. And the chats will be the second Thursday every month going forward. So
Yep.
Questions.
All right, our first question is, my daughter, who is 2 years and 11 months, had an in-school assessment for 1 hour, and then they asked for remote observation, but the remote observation did not go well, and my daughter was crying. They simply told me my daughter had a bad day and to bring her to school for another assessment. They're refusing to give me an IEP based on that 1 hour in-school assessment. So do you have advice for next steps for this person? Review.
So it sounds like the remote observation, the school was not willing to accept the remote observation as valid because they felt like the child's behavior was atypical.
Yes, that's what it
Um,
sounds like to me.
right. So, I mean, I think that first of all, it certainly makes sense to request another remote observation. I think another tool that parents can potentially use during times like this is to videotape their child's behavior and to share that video with the school as evidence of what sort of day-to-day behavior tends to be like. Um, uh, Julie, do you have any other thoughts as to kind of what the
No,
response would be?
those are all great suggestions. And again, the federal and state law is clear that there's a wide range of things that need to be considered. So if the student was getting early intervention services from the young child from Department of Public Health, then those reports and those evaluations can be used. And in fact, our state regulations say that school districts are not required to do additional testing. They could just choose to use what's available from early intervention. I don't know if this particular young child was getting EI services or not. There may be reports or letters from the pediatrician or from others that are working. And so I think, and if things still get stuck, that would be a good point to contact our helpline. I think Lily is giving that, just drop that information into the chat box, because if we knew more of the specifics, it's clearly very urgent for kids who are not yet in special ed to try to mitigate these delays, because time is of the essence. We know that the earlier kids get services, the more effective that can be. So do feel free to call our helpline or contact our helpline.
Thank you. And that phone number and the website are in the chat, so you can copy and paste your question right into the form online. Anyone who has a question and wants to speak with our helpline. Our next question is, what about assessments for English learners? Will translation and interpretation be incorporated into remote assessments?
It's a great question. As far as the testing companies are just kind of in the process of digitizing the tests. And as far as I know, they have not incorporated any translation services or also things like Spanish language versions of the assessments. And so I think that is very likely an area that the technology has not yet caught up with.
So does that mean, just to clarify, that the in-person assessments have a version, let's say in Spanish, but they haven't yet for the modified online materials provided them in language other than English?
That is not, I believe that's the case. I may be able to check on that while we're talking. I know, the in-person assessments definitely do have the Spanish version. The question of whether they've issued the digitized version yet, as far as I know, they have not yet. Although again, I can check on that while we're talking.
Yeah, and Lily is going to be sending, like when we send out the copy of the recording and the slides, we can send the letter that you're talking about that would be useful for parents and advocates, and maybe we can send the answer to this question as well. It's a really good question, and it'll be relevant for families who are non-Spanish speaking as well. Again, to the extent, go ahead, John.
It looks like they actually have issued the WISC in Spanish. So that's the Wechsler Intelligence Scale for Children. So it looks like maybe that one is out, but I think it's probably going to be pretty limited.
So again, then if the school district still has to meet the timelines, then they're going to have to work creatively with the family about how to provide the assessment in the child's primary language in a way that's still valid and reliable. So it's going to take more creativity, it sounds like, in those instances. Is that a fair statement, Joe?
Yeah, I think that's definitely a fair statement. Look, I'm just looking at their offerings right now. It looks like they are rolling out some Spanish language versions of these digitally. It looks like there's a language test that's been put out in Spanish now. But yes, I think that it will require a lot of creativity, whether it's incorporating translation services into the Zoom or however it's done.
Thank you.
Those are a lot of good questions.
Yeah.
Yeah. Our next question is, how will schools evaluate the need for social skills groups if school is remote?
Yeah, I mean, doing social assessment is always very tricky. In general, kind of assessment of social functioning has always just been one of those things that's difficult to capture on performance-based tests. I mean, social skills are kind of one of those things that's difficult to kind of to break down. And so even without COVID, we've always leaned very heavily on the non-performance based aspects of testing to assess social skills. I mean, we have some social tests that ask kids to do things like look at pictures of faces and match them based on who seems to be feeling the same way based on their expression and things like that. But we've always, for social pragmatics, leaned heavily on what parents and teachers observe, as well as on our own observations. And so I think assessing the social pragmatics and the need for social skills intervention is still going to be using scales like the social responsiveness scale or the SRS, which can be completed by parents and by teachers, a couple of similar ones, parent and teacher interviews, and to some degree observation of a child, which can be done remotely. And the loss of performance-based tests for social skills assessment probably is not a huge loss because it was never the pillar of that type of assessment. So I think the short answer is I think we can get a pretty good sense of social skills anyway, and make some good recommendations for what types of interventions kids need.
So circling back to the question about, the family trying to figure out whether or not they should agree to postpone the evaluation or go forward, that's a really good example of how to break it out. Like if you as a parent are concerned about your child's social skills, and we know a lot of parents are really worried about the child's difficulty in making progress or regressing in their social skills with the isolation of the pandemic, then it sounds like there's some real strengths in going forward with a non-performance based, at least you could address the social skills development through the way things that you were talking about, the parent input and teacher input into the formal questionnaires and tools, but also through taking videos to the extent that you may be observing your child interacting with their siblings or in other ways that you can help with the observational components.
Absolutely. Yeah, I absolutely agree with that. I think all of those are important. I think that social, probably more than anything else, social assessment is something that should not be hindered by difficulty with doing in-person assessment.
Great.
Thank you. Our next question is there an age that remote evaluations would not work?
I mean, there's not a hard and fast rule. I sort of informally think of 8 as kind of the age when I start to think about being able to do remote assessments with a kid. I you know, there have been cases when I've worked with younger kids um, when they were not able to come into the office to see me for various reasons. It's just hard. It's really hard to work with the younger kids. Oftentimes when you're working with the younger kids or a child who has substantial communication impairments, you've got to get the parents to help at the other end. And that can be a problem. I mean, that can be hard. It's difficult to kind of guide your child through assessment in a neutral way. I mean, I'll give you a concrete example. I mean, if I'm going to put up 4 pictures on the screen and I'm going to say, there are 4 pictures, can you point to the one that is a horse? Or can you point to the one that is a truck, or something like that, to assess a younger child's vocabulary? So the child points at the screen, and I need the parent to be there. First of all, just helping the child to focus and to orient, but also just to tell me what they pointed to. Because unless I'm really fancy and I set up a second camera shooting over their shoulder in the home, I just need that cueing. The parent, really has to then be able to control the child, communicate with me in a neutral way that does not guide the child. So you can't, if the child points to the cow instead of the horse, you can't say, he pointed to B, Like you've got to like with your voice, you can't sort of, communicate whether it's the right or the wrong answer. So it asks a lot of parents to be able to really be involved in a kind of a sophisticated way with a younger child. So if the child is younger than 8, I start to get to be a little bit hesitant, although I'll try it if I have to.
So I'm wondering if these are such good questions, if part of whether you have to, it depends on what the urgency is for the child, right? Like if it's a child who the school district's not going to move ahead and start providing any services without some form of performance-based assessment, it makes me think about another conversation you and I have had, is then if you had to, what you explained to me in another conversation is if you had to perform an assessment of let's say the parent who was talking about the 3-year-old or a 5-year-old, in the report, you would address the parts that there was a confidence about and would be straightforward about the parts where it was more difficult to assess. As long as the evaluator is saying what they know reliably and what they're not sure about, then when the pandemic's over, you can go back and do these other parts of the assessment that you weren't able to complete. Is that can you still kind of report what works and what doesn't as you do a performance-based assessment if you have to?
Yeah, yeah, absolutely. I mean, in the report, yes, in the report you describe it. I mean, I was just reviewing a report today that I did earlier in the pandemic in May. And, it says in the report, I gave this child a reading comprehension test remotely. He got a really low score. 2 months later, I was able to bring him into the office with a mask on and give him a different reading comprehension test. He tests significantly higher. And, I think that we're probably getting some unreliability in the reading assessment based on the way that it's being done. And, and you talk through it. So yeah, that is absolutely the case.
Great, thank you. Do we have time for one more question, Lilia?
Yep, we've got one more question. Can you please give some examples about how you would do transition assessments at this time?
So, obviously it depends on what's going to be involved in the transition assessment. Some aspects of transition assessment can be very easily done during this time. For example, we'll typically do life skills questionnaires and things like that as part of a transition assessment. And that is very easy to do. Some parts of the transition assessment, such as intellectual testing, if that's going to be an important component of it, or academic skills testing, are also very good, very, very well, can be administered very well over remotely. So the WAIS, for example, the Wechsler Adult Intelligence Scale, which is an important part of many transition assessments, is one of the good ones to be able to be done remotely. I think that what tends to be a little bit harder for the transition assessments are the observations. Oftentimes for transition assessments, you want to think about doing things like observing somebody in the community or observing somebody in a vocational setting or something like that. And those are obviously the things that none of us can do anymore. And so I think it's really important with those to be getting collateral contacts. So, I will talk to, if somebody's been doing some kind of work, if somebody was doing some kind of work before the shutdown, I will try to talk to the employer, try to talk to the person, try to talk to the supervisor, try to talk to the teachers. And so, a lot of the data you can get quite well. And then otherwise, you really just have to fill in the blanks by making contact with the people who have been working with that individual.
Those are great creative approaches because the observation piece really is difficult.
Yeah, absolutely. Especially when you're thinking about a community-based observation. I can do the iPad in a classroom. I've done the iPad assessment in a residential setting. But yeah, it's much, much harder. I know I used to be able to do fun things like go to classes kids were taking in the community or job sites or things like that and observe people, and obviously that's gotten to be just much, much harder.
Great. Well, thank you, Joe. This has been just terrific. It's a wealth of information. I know that it's been really invaluable for those who are participating and those who are going to watch this later. So thank you. It's always so generous supporting the families we work with at Mass Advocates for Children, and we just really appreciate the partnership and the many ways you help so many kids.
Thank you. It's a pleasure
Thank
to be
you.
here and to see everybody.
Right,
Thank
and
you so
everybody
much.
have a safe holiday period, as different as this coming up holiday period is going to be for everybody, whatever holidays you celebrate, and stay as safe and as well as you can. And we look forward to seeing you January
14th.
14th, the second Thursday in January. Take care, everybody.
See you
Stay
in the
well.
new
Good night,
year.
everybody. Thank you,
Thank
Joe.
you. Thank you.